Hi, I decided to do this one as a video because it started as a conversation Leah and I had last night, just about the kind of current hot topic, which is healthcare. We threw it around and we bounced it back and forth, and then we went to bed, and I guess it kind of stuck with me all night because I woke up this morning thinking about it and kind of some key questions that are related to it. Namely, first of all, are we guaranteed free market capitalism by our core legal documents, so the Constitution and the amendments? And then, regardless, is capitalism always the best mechanism to regulate any industry, and specifically healthcare? And then, lastly, where has capitalism left us today? So, with thinking about that when I woke up, I did just some light research, and I looked up the Constitution and the 27 amendments. I read through them all, and the answer is no. The Constitution does not guarantee capitalism. The only guarantee it makes kind of in that regard is private property. And then, yes, private property leads naturally to private industry as people try to use their property to, create some sort of a profit for themselves. But the Constitution doesn't establish capitalism as the de facto economic system for our country. And so, with that in mind, with private property kind of being the key there, you have to realize that healthcare isn't property; it's a service. The property involved is our own health, our bodies, which are our own private property. And the way the current industry has worked out, it's commercialized our health for us, and now it's turned it around and tried to sell that back to us, and at much higher prices than most of us can afford. So the idea behind capitalism is that demand will strike a balance with supply, and then prices will regulate accordingly, and they'll bear only what consumers are willing to pay. But how does a system like that make sense for something healthcare that everybody demands? There's no balance to be achieved other than giving everyone proper healthcare. And then when that happens and prices reach beyond what people can afford, demand doesn't fall off. Demand's just not met. And why can't people afford it though as it goes up? And the answer again lies in capitalism. Capitalism allows for the existence of an ever-growing population of working poor, people that work for the big players in capitalism, corporations that don't pay them enough to even support themselves. So these people are working at jobs, trying to make a living, but they're not even making enough to meet their own ends. They're actually requiring government assistance to meet their own ends, even though they are employed. So when these people can't even afford to meet their basic needs, most of them then can't afford the health care that's provided by these corporations. And even if they do decide to shell out the money to pay for the health care, it's usually not great. It's usually not hardly even significant. They'll go to the doctor, and any out-of-pocket expenses they still can't cover. So they work, pay for health care, and they still don't get medical care out of it. And it's not at all helpful for me to say capitalism's not the answer. I mean, our healthcare system sucks. What we actually need are solutions. For that, I would recommend the Frontline video, which I'll provide a link to. It has possible alternatives from other countries. The big thing to get out of it, though, is that no country has a system of national health care that actually works 100% and is foolproof. But that's what we can do. It would be great if America could take the lead in something like this and find a great system that works for everyone. If as a country we could say, what, screw capitalist tradition, it hasn't worked for us, it's failed us in this particular regard, and we can actually learn from that failure, see what's gone wrong, and accept a non-traditional solution that's designed for it to work, and make life better for all Americans. And ultimately, life better for all Americans should be the goal of any national policy. And that's where the debate should start. It's not whether our healthcare system is broken. It is. The debate should be what radical change will now save us. And this is where all of us come in. All voices are important in an issue like this. So we have to raise the level of public debate and ask ourselves and each other, where do we go from here?